Hi, this is Mark. I'm the guy that had the original PRK laser surgery done. It's been about 4 years, and I thought I'd do a little video update. Everybody's asked lots of questions. I'm surprised. I've actually had over 100,000 views of this video that I posted back in 2005. And anyway, I was in a car accident recently, and so I'm off work for 2 months, and I'm a little bored, so I thought I would do up an update video for everybody. I'm not trying to sell anything. I don't work with a laser eye surgery clinic. I'm just a patient who's really happy with the results. So what to talk about? Well, it's 4 years later. People wondering if how my eyes are, and they're fantastic. I have 20/20 vision, and I'm so happy that I did this. It was the best single thing I've ever done for myself. The costs have actually come down since I did mine. I did mine in, again, December of 2005, and I think the price was about $1,500 an eye, so $3,000 here in Canada. And I think now you can get them done for, $500 to $800 an eye, which is amazing. I don't know why everybody doesn't do it. But yeah, it's 20/20 vision, and it's been like that since about 10 days after the surgery. So I'm really happy with it. What happened on the surgery, just to give you a bit of a background, what goes on is, on the day of the surgery, they bring you in there and they sit you down and they say, we're going to do our thing now. And, I was a little bit nervous, like most people. I don't want people touching my eyes, and, I was a little bit freaked out. What happens if something goes wrong? I'll be blind and all that stuff, right? But they bring you in, they calm you right down if you're a little anxious, and they give you a little pill called Ativan. Ativan is like an anti-anxiety medication. And so it just takes the edge off, and so you're nice and calm and relaxed. And they take you into the room, and they sit you down, and they put some eye drops in your eyes, which are like, I guess they're like a numbing agent, and so you just don't feel anything at all. And then they, they talk to you, and they say, okay, we're going to get started now. And so they put these little devices on your eye, just keep your eyelids open so you don't blink while they're doing things. And they put this machine over top of your head, and you just look up, and they say, look for the little red dot. So you see the little red dot in there, you look up at it, it says, just keep looking at that. And they say, we're going to get started now, okay? And you say, yeah, fine. And at this point, I'm nice and calm, and everything's good, probably because of the Ativan and the eye drops and all that. I'm feeling quite happy. And so they say, okay, we're going to get started, and then that's when the video proceeds that you've already seen. So a little machine goes on, and you hear this tick, 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 and I guess that's the laser going and making the modifications to your eye. You feel nothing. If you didn't hear anything, you wouldn't even know that it was going on. And so this goes on for a few minutes. They do one eye, and then they do the other eye, and you're done. And it's that simple. At the end of it, you're amazed, like, that's it? That's all you're going to do? So it's quite... Oh, one thing I forgot. With PRK surgery, the difference from Lasic is with Lasic, they cut a flapper and they lift your eye, the outer layer of your eye. I'm not a doctor, so I don't know the technical terms, but the outer layer of skin, if you want to call it that, of your eye, and the laser goes through that. With PRK, they don't cut that flap. What they do is they just remove it with a little device, so that in the beginning of the video you see this circular rotating little device, and it just goes on there, and it just kind of like removes the outer layer of skin or membrane or whatever it's called, so they can get through. And then the reason that PRK takes longer to heal is because instead of just the flap, the little seal healing, that whole bit of skin or whatever has to grow back. So anyways, they did the removal of that stuff first, which takes a few seconds, and it's not uncomfortable. It just something touches your eye and you kind of feel it. You're like, oh, that's an odd feeling, because you're not used to things touching your eye, but it doesn't hurt at all. There's no bad feelings or anything. And then the machine does its thing, and they say you're done. And it literally takes all of about 10 minutes or so. It's been 4 years now, so my memory is a little bit foggy of the whole procedure, but it's about 15 minutes or so, really quick. And after that, they say, okay, well, they put some more eye drops in your eyes, I guess, for whatever reason. And they take you into a recovery room, and they sit you down, and the nurse goes, okay, this is what's going to happen over the next few days. And they explain to you that at night you're going to want to wear these eye patches. It's just like a little plastic eye cover, and you tape them onto your face so that you don't roll under your eye because you don't have any pressure on it or anything. And so for the first day, they say, just here's a sleeping pill, take a sleeping pill, and knock yourself out for a day and just sleep, keep your eyes closed, and all that. And they also put a little a contact on your eye for the first 3 days. I guess it helps in the healing process. So after 3 days, you go back and they take the contact off, and then it's just you and your eye. And already within 3 days, your eyes are better than they ever were with glasses. But they take the contact off after 3 days, and your vision gets a little bit fuzzy again because I guess you're changing the dynamic with the contact lens coming off. So anyways, you take the contact lens off, and then within about 10 days, your vision is almost 20/20. it's amazingly quick how fast everything happens. And then over the next 6 months, you get that last 10% all the way up to 2020. As far as discomfort and things, the best way to describe it is like if you've ever been in a chlorinated pool, like you go swimming at a recreational complex or something, and there's there's chlorine in the water, and you go underwater and you open your eyes and stuff, and you can come up and you notice a little bit of a, not a stinging, I guess, but it's a, well, I guess it's a bit of a stinging, like chlorinated water. That's what this feels like. But of course they give you painkillers for your first few days, so it really takes the edge off. You just kind of barely notice it. So, but over the first 3 days, your eyes are quite sensitive to light, and you can't really watch TV and things like that. But after the 3 days, your contact lens comes off, and then a few more days after that, you're pretty much good, and you're seeing clearly, and it just gets better from there over time. So, it worked out really well for me. I was really happy with it. Again, the results are 4 years later, I'm seeing 20/20, and again, I'd recommend it to anybody that wants to know. It was awesome. Best thing I ever did for myself. I'd probably pay 10 grand for it if I had to, but luckily it's not that much money, so it made it easy for me to decide to do it. What else to tell you? Let's see, that's the recovery time, and so, I've had lots of people ask me lots of questions on the YouTube comments area, and people are asking how I'm doing and stuff. I think I've answered that. Is Lasic or Prk safer? I think they're both the same, but if you're not aware, I'll just explain the difference between Prk and Lasik. Again, I'm not a doctor, I'm just a patient, but they explained it to me before I went in. Typically what they'll do is they'll do an assessment of you when you go in there, and they'll find out if you're a good candidate for either the Prk procedure or the Lasik procedure, and that'll depend on things like your biology, the thickness of the membrane of your eye, and things like that, right? Lasik basically is where they cut a little flap in your eye, that outer layer, they lift it up, and the laser goes through that, and they put the layer back down, and then it heals. The advantage of the Lasik is that it's really quick. My wife had it done. That's what inspired me to get mine done. And later that day, she was seeing 20/20, and her recovery was like a couple days. It was fantastic. She had, she was back up to speed in no time, which was great. Now, she was a candidate for Lasik because of the thickness of the outer layer of her eye. It was thick enough to handle that. But when I went in, my eye, for some reason, the outer membrane of my eye, or the skin, or whatever you want to call it, wasn't thick enough. So they said I wasn't a good candidate for Lasik. So if I wanted to have laser surgery, I'd have to have Prk. Now, some people say Prk is even better, but the problem with that is it just takes longer to recover. Because where Lasik, they lift a flap up and they put it back down, so it just has to heal around that cut edge. With Prk, they actually have to, instead of lifting a flap up, they have to remove that skin with the device, actually physically remove that. Then they do their laser stuff, and then your body has to grow that back. So you have to, it can take months for you to fully grow back that skin, or whatever you want to call it, in the eye to be better. The advantage of Prk is a lot of people say the results are even better, and but the disadvantage is that it takes longer. It takes up to 6 months to fully heal, and there's a little more pain, and you're in pain for maybe, or the chlorinated kind of pain for 3, 4, 5 days, whereas with Lasik it's really quick apparently. So, but they say police officers, they want them to have Prk, or firefighters, because some people have said, and I've sort of heard this is a rumor, I don't know, but they've said that if you've had Lasik surgery where it's cut and lifted the flap up, and you get impacted in the face, it can tear that flap, and that can obviously cause problems. Whereas, because the flap is just healed along that edge, but it's not maybe as strong as before the surgery. But with Prk, because there's no cut, it just heals back. There's no chance of that ever happening. So it's for people that are in more dangerous type of work. If you're a physical person, firefighter, or a cop, or something like that, or military, they want you to get Prk. But if you can get Lasik, I would get Lasik because the recovery is much quicker. But if you have to get Prk, so be it. Still totally worth it. Both are about the same as far as safety. I think it's as safe as going to your dentist. It's a totally safe procedure. Yeah, that's about it. Again, I feel great. My wife had the Lasik done. She loves it. I would have had Lasik done if I was a candidate for Lasik, but I wasn't, so I had Prk, and it's totally great. The only negative thing I'd say about the whole process, the only thing I could say, which was a little bit of a negative is that sometimes I get dry eyes, where I wake up in the morning and you know, I have to put eye drops in because you know, they feel a little bit dried out. But that hasn't happened to me in over a year, and even then, for the first couple of years, it was maybe once a month, not a big deal. Again, totally worth it. So I hope I haven't bored you to tears. I'm just kind of keeping myself occupied after my car accident because I'm off work. So hope you enjoyed the follow-up, and if you have any more questions, let me know. If it takes me a while to answer you, I'm sorry, I just don't get onto YouTube very often to check my messages and stuff. But have patience and I'll try and get back to you, or hopefully just answer all your questions. Anyway, bye-bye.